Let's bring in Dr. Joe Congini, Akron Children's Hospital, with us this morning for this Wednesday visit. Good morning, Dr. Joe.
Hey, Ray. How you doing today?
I'm doing really well.
Great.
What do you got?
I want to talk about one of the shoulder injuries that's about the most common shoulder injury we see in sports medicine for young people. And it's a little bit confusing. It's called shoulder instability. You know, we use a lot of medical code words so people think we're smart and don't know what they mean. What's shoulder instability mean? Mm-hmm. It's looseness of the shoulder that occurs in athletes. And one way athletes get looseness of the shoulder that we do talk about here a lot is people dislocate their shoulder blocking or making a tackle or wrestling, or and the shoulder pops out and tears the ligaments in one spot, and that's where the shoulder slips out at. But even more common is an injury that's from overload or overuse, and the entire ligament capsule and muscles around the shoulder get stretched out. And this occurs this time of year, and they're already coming in. The swimmers in the winter, swimmer's shoulder. We see it a lot in the volleyball servers and the tennis servers and the pitchers in the summer. And it's called multi-directional instability. Fancy words again. Yeah. The shoulder's like a ball in a socket, but it's more like a ball on a little golf tee. And to hold it there right, there's muscles and ligaments all around that hold that ball on the golf tee. And when they get stretched out or when they get weak and the ball starts slipping off the golf tee when you're trying to serve the volleyball or you're trying to swim, this thing keeps popping on and off the golf tee, and pain and swelling and possibly labral tears, and it's a really painful problem. And so you'd probably say, as athletes come in my office all the time, they say, hey, gosh, show me the surgeon that's going to come and tighten that shoulder. That surgery stinks. For years in the past, they used to try to tighten up the shoulder, and it didn't work very good, and it was too tight, and people could never play sports again. So surgery's like the last resort for it, and the treatment of it is really getting in there and working hard on a course of physical therapy, and it averages about 6 or 8 weeks of PT to tighten up all those muscles and to balance those 8 muscles that attach around the ball and socket of the shoulder and get that shoulder stable again. Stable's our word. Unstable we don't like. That means slipping around. Stable means the ball's sitting on the golf tee and people are ready to start serving again or swimming again. But of course they don't like to miss during the season, and they struggle as they get through the season. But you generate more force as a server when you get your shoulder back further and you stretch out those capsules and the ligament. So multi-directional instability is a little hard to understand. Probably our number one diagnosis. Right now, I guarantee you, swimmers all over town, they go to the 2-a-days and 3-a-days over break. They're struggling with this. Your baseball players at Wadsworth and stuff struggle with this. And it's a very common problem, and unfortunately it takes some time and rehab to get better. But the good news is it does get better with rehab. It rarely needs surgery. It doesn't need shots or things like adult problems, and it's a real common injury that I kind of wanted people to understand the difference between that and a dislocated shoulder.
For a preventative, I mean, for these young athletes, that's where the weight room work can pay off, right?
Absolutely. And thanks for mentioning, because in the weight room, kids like to work on what are known in the weight room as the mirror muscles.
You're
so
right.
They're working on the pecs and they're working on the delts and the ones in front that you can see. And it's the ones in back that are called the scapular stabilizers, 8 of them, that really hold the ball on the golf tee the best. And we do the first exam, and there's a huge imbalance between the muscles in front are much stronger, the muscles in back. So we teach them this, and the good athletes really take this to heart, and all of a sudden they're throwing the baseball faster, their times are better in swimming. So I tell them it's going to be a win-win if you do these exercises over the next 2 months or so, and then keep it as a part of your program. You're going to improve performance, which will make you happy, and you're not going to be injured, which is going to make your parents and I happy. So it is a balancing act in the weight room as well.
Once that loosens up and gets loose, though, what's the percentage of that recurring again? I know the rehab and strengthening will help again, but are you more open to that happening again?
Well, as I say to you all the time, that is exactly why you'll find my office at the Children's Hospital, because working with kids, they're much more resilient, much more chance they'll bounce back. Our percentage with this problem, if people really do their rehabs, 80% plus get better, stay better, and do well. When you start looking at this more in the adult population, that percentage drops a little bit. Unfortunately, this might be memo to me or you. Hey, as we start to age, some things don't heal as quickly and as well. But in young kids, really good healing rate. 80% will do better. It's just we got to lead them. They come in, they're so frustrated, and they feel that popping and snapping in the shoulder, and they have pain every time and then they come out of rehab and they're like, wow, thank you. That really helped a lot. So it's a good thing to know, and I just want people to be aware of this thing called shoulder instability.
Dr. Joe Congini with us, Akron Children's Hospital, WAKR. Thanks, Joe. And next week, so we won't see you for actually a couple of weeks,
right?
Yeah,
we're going to be off for a couple of weeks. And I wanted to tell you, I'll be back in 2020. We have a new tool in 2020 where we can track our high schools. At high schools like Highland and Hudson and Hoban that we cover, we had 350 to 380 athletes this fall. There's a lot of athletes to track. And in the old way of making notes on pad and pencil about what kind of problems they had, our trainers would make these notes. Many of these big high schools need 2 trainers now. The University of Wadsworth is a huge school. So keeping up with that is hard. There's a new tool that we can do it with an iPad, and the trainer has the iPad. They call me and they go, you remember that freshman? I can't remember, 80 kids maybe that we've seen. And so now everything is going to be on an iPad. There's about 10 other programs in Ohio using this thing called Healthy Roster. We can look up their MRI, look up their lab results when we're out on the field. We can communicate with parents and coaches much easier. And so we're really excited in 2020 about a thing called Healthy Roster.
Good stuff. Have a good holiday, my friend.
Have a great holiday, Race. Thank you so much.
See you next year.
That sounds good.
All right. Dr. Joe Congini takes time out of his busy schedule. He joins us Wednesdays for in-office visits.